Ellen Harris is a former collegiate tennis and field hockey player. She later became a runner, competing in marathons. Now retired at age 61, she continues to be just as active.
I moved down here to the Cape full-time 3 years ago and had gotten tired of running, and so I figured it was time to pick up competitive tennis again.
Recently, Ellen incurred an injury around her home.
I got injured picking up a hardened bag of cement as I was clearing the property. I thought I was 21 again. Picked it up, carried it about 10 feet, and dropped it. The next day, I couldn't roll over in bed. I went and saw a chiropractor, and he started treating me. And I play tennis with Sue, and I'm like, this is what he diagnosed. And she's like, I don't know, Ellen.
Her tennis partner, Sue, is actually Dr. Susan Ehrenthal, a physiatrist at Spaulding Rehabilitation Hospital, Cape Cod. Located in Sandwich, the facility has both inpatient and outpatient services.
Physiatrists are physicians who specialize in physical medicine and rehabilitation. We look at the whole body, and not only their body, but what's important to them in their lifestyle. Are they someone who's physically active? Do they exercise regularly? Do they want to get back to playing a recreational sport, a competitive sport? Do they want to just get back to being able to walk longer distances?
Sue is a former collegiate athlete herself.
As an athlete, I think I appreciate more what it takes to be an athlete. I practice what I preach. I recommend to my patients what I know has worked for me, as well as what the latest research suggests. The nice thing about treating athletes is that athletes are motivated people. If anything, sometimes you have to tell them to take a break before they return to playing because you have to allow your body time to heal. And I understand as an athlete myself that desire to get back on the playing field, not just for the physical benefits, the weight loss, the cardiovascular training, but also mentally.
We looked at charts, we looked at pictures, and she would show me exactly how I did it and pinpointed the muscles and the nerves. I needed it all explained to me, and Sue was very, very good in doing that. It wasn't when I lifted the bag of cement up, it was when I dropped it. I pinched a nerve and then created a sort of bursitis in a disc. It sort of compounded it. I'm 61 years old and I had never been on crutches before in all my athletic years. So this was a killer.
On the Cape especially, we're dealing with an aging population, so it might be hard to accept that one's not going to heal as quickly as one used to heal.
I used to be able to run out in the court and just do whatever I wanted to do, and right now you have to stretch a little bit more, prep your body a little bit more than you used to.
Ellen's rehabilitation at Spaulding has led to a full return to what she loves.
It's getting better and better every time I see her playing. I never say never. I say, let's try this and see what happens. And if that doesn't work, let's try another approach. Physiatrists are trying to get our patients back to playing their sport. We're not saying, oh, you're too old, you can't do that.
People understanding people. Athletes helping athletes. At Spaulding, regardless of the sport or competitive level, the medical professionals are there to make sure you can continue your athletic passions.
Spaulding is a very unique institution. We have a lot of vision from our chair, Dr. Rossavant, to advance sports medicine, both at the local level as well as at a national and international level. So that's really created the environment where everyone wants to up their game and wants to do the best they can by athletes.
A lot of times in medicine, when something hurts, the doctor says, well, stop doing that thing. Sometimes what we'll say is, if something is hurting you, let's change how you do that activity. Let's make an impact on how you move.
Our team at Spaulding focuses on getting to know the individual. We think about what's important for each person and helping them to get the most out of their rehabilitation.
The basis of what we do is we enable opportunities for people of all abilities to live active lifestyles and to engage in sports and recreation. We also use that as a platform for education. People know us as Spaulding Rehabilitation Hospital. There's a lot more that goes on here.